how to manage intrauterine adhesions where the endometrium gets stuck. And this was quite a nice commentary in Fertility Sterility. And what they were looking at is case control study on intrauterine adhesions. What were the statistics? 292 patients with moderate to severe intrauterine adhesions underwent a transcervical resection of adhesions. The success rate by that procedure was 82%. 240 patients showed a normal uterine cavity on follow up. 18% had a recurrence of adhesions, and which means that 52 patients experienced adhesion reformation. What are the interventions? Resection for all patients, they used a barrier gel application during initial surgery, a 16 Foley balloon placement for 5 days, sequential estrogen and progesterone therapy, and a second local hysteroscopy in 2 months' time. In some cases, they used additional barrier gel at balloon removal, repeated balloon insertion, 2 to 3 cycles. What were the key learnings from that study? It was reapplication of barrier gel 5 days after resection of adhesions. They said reduces the recurrence risk. Chronic endometritis is a significant risk factor for intrauterine recurrence, which is infection and inflammation, 69.7% with diagnostic accuracy. Cold scissors were more effective than electrosurgery for resection of adhesions, and combined interventions using gel, balloon, and hormones showed promising results. Though isolating each intervention requires much bigger studies, now routine endometrial assessment is generally considered better. Now, what does this tell us? This tells us that there are multiple options you need to consider if you're looking at preventing recurrence of adhesions or treating intrauterine adhesions. And what this study looked at is looking at various factors which can be used and various techniques that can be used to prevent recurrence of adhesions.